and we're going to summarize, conclude, and ask some questions. So first of all, they are common, they're quite common. About 80% of Black women will have fibroids by the time they're 50, and 70% of white women will have fibroids as well. But they're not always symptomatic. And if you may have fibroids, but they may just not be symptomatic, and you may never even know you have them. So what are they exactly? Well, they are the growth of the smooth muscle in the womb. They could be single or multiple. They could vary in size. It could be microscopic, where you can see it, 1 to 2 centimeters, and they can go all the way up to more than 30 centimeters. So they can get quite large. We know that they grow in response to steroids, sex hormones, estrogen and progesterone. And they're composed of irregular bundles of the smooth muscle cells of the womb. And what they do, they grow an excessive amount of connective or fibrous tissue. And that is where we get the name fibroids from, because there's quite a lot of fibrous tissue with a bit of smooth muscle from the uterus. So this is a picture of uterine fibroids. So this patient had a myomectomy where they removed the fibroids bit by bit, okay? And you can see they're quite large. They range from quite small fibroids to quite large fibroids. And this is from one patient. So we know that the cost of fibroids, the cost is quite high. It can cost up to $34 billion in the US annually in direct and indirect costs. So we're talking about treatment, we're talking about time off work, loss of income because of this condition. It severely affects or can alter the quality of life, and it has a severe effect, can have a severe effect on the reproductive health of women. So this little diagram shows the fibroids can be positioned in different areas. You have the fibroids that are growing in the middle of the womb, so in the muscle of the womb, and that's called intramural. Pedunculated when they are on a little pedicle, they're on a little stalk on the outside of the womb, such as that one on top there. Now, if you have a fibroid kind of blocking the fallopian tubes, that could result in infertility, because you can't have your fertilized egg and sperm actually coming down to implant into the womb. So it kind of blocks that transition. And fibroids that are lying in the lining of the womb, the endometrium, they could also prevent implantation of the fertilized egg into the womb. So they can, depending on the position of the fibroids, they can result in various symptoms. With fertility as well, some women do get pregnant even with fibroids, but depending on the position, say your fibroid is near the neck of the womb, that can actually obstruct labor, and you may need a cesarean section to deliver your baby. So they have quite wide-ranging effects. So as I mentioned, they're not always symptomatic, but in 30 to 50% of women, they can have symptoms. The size and location determine the symptoms. We know that heavy menstrual bleeding is, as a result of, can come from fibroids, and that can lead to anemia, so a low blood count. If the fibroids are bulky, they can press on the bladder, or they could press on the bowel or the rectum. On the bladder, if they're pressing on the bladder, that could result in urinary symptoms, and on the bowel can result in constipation. And they can also have symptoms of pain, including painful intercourse and infertility. So 25% of women between the ages of 18 and 30 will experience symptoms, compared to their white counterparts that only experience it in about 6%. And in Black women, the incidence can rise to about 60% by the age of 35. So you see it's quite significant in the Black population. Black women have higher rates of reoccurrence following surgical treatment. And we know the risk factors are women of African ancestry, women that are obese, have high blood pressure, consume alcohol, smoking, and even vitamin D deficiency. So these are the risk factors for uterine fibroids. So we still don't know the exact cause. I must say a lot of research hasn't been done on this. The research done on fibroids, only 15% of the women are actually Black women that are involved in the research. So there's a disproportionate amount of Black women involved in the research that has been done. So this is definitely an area that we need to improve on. As I mentioned, sex steroids play a significant role, the estrogen and the progesterone. So you find your estrogen stimulating the fibroids to grow, and that is why they grow in the reproductive years. So from puberty up until the age of menopause. After menopause, you don't have that estrogen influence, so the fibroids actually shrink. But we do know fibroids, they contain high level of receptors for estrogen and progesterone. So they're stimulated quite a lot by the estrogen hormones. And they do impact quite a lot on the woman's quality of life, including her physical and social activities and relationships. So this is a quote from a patient with uterine fibroids. She says, "This is what you go through as a woman. Like every month you're going to bleed half to death. And then half the time you are almost okay. I just went with that. You know, it didn't kill me. So I just thought it would make me stronger." So this is what a lot of women go through every month. They put up with it. They normalize it. And they just think that this is part of normal life to have heavy menstrual bleeding with flooding, clots, and unfortunately, we see quite a lot of women coming in, first presentation to hospital, and they're quite anemic, needing a blood transfusion, or because of these uterine fibroids. So how do we make a diagnosis? Well, when you see your GP, I think that should be the first port of call. Make an appointment to see your doctor. He will ask you your medical and family history. We do know that it is genetic, that if your mom and sisters have had fibroids, that you have a high chance of having that too. The doctor may want to do a pelvic examination, see if you can feel any masses abdominally. And usually the first option of diagnosis is an ultrasound scan. We do need to get a little bit better in reporting fibroids on our scans. We need to know how big it is, where it's located, not just that you've got fibroids, but we need to have some more information about the location and how large it is. We have used MRI. We do use MRI to also locate fibroids, especially those that are large in size, especially if they're impinging on other organs in the body, like the ureters, the tubes leading from the kidneys to the bladder. Sometimes if the fibroid grows, it can actually compress this tube, and it could lead to backflow of urine into the kidney, and urinary symptoms as well, urinary infections. So we need MRI scan to say exactly what position this fibroid is in, especially before surgery. Things like an X-ray and CT scans are not so helpful. So what are your treatment options? Before I get into that, I would say women that are bleeding heavily every month need to be, first of all, on iron supplementation. And sometimes we forget that that is like the first line when patients come in with heavy bleeding. So they're likely to be anemic, and it's important that they get on iron supplementation. Sometimes the hemoglobin count is normal, but the iron stores are low, called ferritin, that's low. And that also needs to be improved with iron supplementation. So your medical options would be things like, I would say tranexamic acid first. I think that works for about 50% of women. It is non-hormonal. I know a lot of women don't like going on hormonal medication like the pill or norethistérone, which is another hormone. So tranexamic acid is one of those that you can take just for the duration of the heavy bleeding. And it results in a significant reduction in the amount of blood loss during the period. Now, it doesn't shrink the size of the fibroid. It doesn't do anything to the size of the fibroid. But some women can have relief from their symptoms, especially if it's mild or moderate. And some women cope well just being on the tranexamic acid. Other medical treatments would be things orally. You can take oral hormonal medication like the oral contraceptive pill. The Mirena IUD is a little device that looks like a coil. It has a hormone implant in it that releases slowly over a period of time and actually thins down the lining of the womb. So again, it doesn't shrink the fibroid, it just helps to deal with the symptoms of the fibroid, which is the heavy menstrual bleeding. We have other medications, hormonal medications that you can take, injections, gonadotropins. Those do shrink the size of the fibroid, but it's reversible. So once you stop, the fibroids do go back again, unfortunately. But for some women, it provides enough relief and it gives them time to build back their blood count. It shrinks down the size of the fibroids. So prior to surgery, the fibroids aren't as big and difficult to operate on. So they do have a place in the management. And then we have the surgical options, as you know, the hysterectomy. It could be done via keyhole. You need to attend, obviously, a specialist center for that. It can be done as an open operation, especially if it's multiple large fibroids. There's also a procedure called hysteroscopic myomectomy. So that is basically using a small camera into the womb, and the fibroids that are on the lining of the womb can easily be removed by resection, by removing it. The non-surgical alternatives, uterine artery embolization, again, it's a specialist field, and small particles are introduced into the blood supply to the womb. The blood supply is occluded, and that occludes the blood supply feeding those fibroids, and those fibroids eventually shrink. But for some women, it can cause pain, it can affect their fertility. So it's usually used for women who don't want a surgical option, but at the same time, they're not planning to have kids in the future. We have another new technique called fibroid ablation. And the one used, that's been recently been used at St. Mary's about a month ago, it's new to the Northwest, is called Sonata. So I'll talk a little bit about that again, because that's a little bit exciting for us, because for quite some time, we haven't had any really new treatments for the treatment of fibroids that are non-surgical. So this new development is new, and it doesn't involve any open surgery or even laparoscopic surgery, and it's more effective than medical management. Okay, so basically these are the principles of the Sonata treatment. It's a handheld device that uses an ultrasound scan, high resolution ultrasound scan. So you introduce this device into the womb, as you can see from the first picture. There's a fibroid there. And their ultrasound waves would help to detect where this fibroid is, so the doctor can see it on his screen. And then there's another device that uses high frequency energy to shrink the fibroid. And this happens over a period of time. So the actual procedure is about an hour, but over a period of weeks to months, this fibroid actually shrinks, and it involves, it gives patients quite a lot of relief from their symptoms. It's quite effective. So I'd like to play a video on patient experiences with uterine fibroids. And I believe that will come up soon. Are you able to get the video up? There we go.
It affected my life daily because for me, my symptoms were constant bleeding. So it was essentially having my period all month long. That just never went away. But with my only option being a hysterectomy, I thought a better option would just be to deal with the symptoms than to have my body parts removed.
I was taking sick days because I just couldn't get out of bed.
When you have to worry about having an embarrassing incident, or you really just don't feel confident, you limit yourself, you isolate yourself. Do I need an extra change of clothes? What am I really going to be doing today?
Can I get this in there now?
Today. Maybe I'll do that in a couple of weeks. My symptoms got so bad that I actually had to change careers.
Why are you laughing is
Find something that I could have control over my days and hours.
I know it's got a mark on it, so it's probably...
I could not continue taking days off of work because I couldn't get out of bed. There was no treatment for fibroids. It was deal with it. You're making a bigger deal out of your cycle than what it really is. When you're over 50, we'll talk about doing a hysterectomy.
I mean, I missed so much work that I end up getting fired because, I mean, your job don't really understand that. My symptoms became better immediately, right off the bat. I know this sounds weird, but I can wear white pants and not be nervous about it. When I'm on my period, I just go out more. Before, when I was on my period, I was like, I'm not doing that. I just didn't want to be out in public and couldn't get somewhere to take care of my needs. So, but now it's like, okay, fine, let's do it. I had lived with it for so long, I thought it was normal. And then now I have a new normal. And this is fantastic because I can do whatever I want, whenever I want, and I don't have to go through that anymore.
There's things to consider, that you don't have to be out 6 or 8 weeks and have part of you removed permanently.
I would tell a woman thinking about this versus a hysterectomy that I believe it's the way to go.
Life-changing, minimally invasive. I would look at it as a first option and go from there.
It may sound too good to be true, but it is true. It's that easy. Very easy. I would tell a woman who's thinking about this to do it. It's well worth it. It is really, really well worth it. The downtime is minimum. Everything. It was just really good. It was a good experience.
You can always get a hysterectomy further down the road, but for a busy mom or someone who just cannot take the time off or doesn't want something that invasive in their body, I would definitely tell them to try the Sonata.
Patrice, you're on mute. Thank you.
Right. Thank you. So I'll go back to share my screen again. Okay, so I thought that video was quite impactful. I mean, what really struck me was when this woman said that she had to change her career because of her condition, because of her symptoms. And it made me realize that there are women out there really suffering with this condition. And Is it a lack of information? Is it because they can't access proper healthcare advice? I'm not so sure. I know these are experiences in America where the healthcare is completely different and you have to pay a lot for treatment. But I think I will hear from you out there in the audience what your difficulties, if there are any difficulties at all, of accessing treatment for uterine fibroids. I would like to hear your experiences once I'm through with this. Okay, let's carry on. So how do we prevent this? What can we do as Black women or women of ethnic minorities or just women in general to prevent the impact of uterine fibroids on our lives? Well, as I mentioned, obesity is a factor to play in uterine fibroids and how severe they can become. So it's important to maintain a healthy weight via healthy eating and routine exercise. Again, I mentioned hypertension is one of the risk factors. Maintaining a blood pressure below 130/80 is a good one to aim for, good blood pressure level to aim for. Reducing unhealthy stress. We as a community, as medical personnel, we have to see how we can go about eliminating health disparities, access of women to quality care, early diagnosis, and discourage the normalization of pain and heavy menstrual bleeding as a normal part of being Black, being a Black woman. We need more research to explain the genetic, social, and environmental factors that contribute to the high prevalence of fibroids. So in conclusion, uterine fibroids, as I said, they're common. They can be symptomatic in some people. Because you have uterine fibroids doesn't necessarily mean you need treatment, you need removed, but if they become symptomatic, if they're affecting your lifestyle, if they're preventing you from becoming pregnant, it needs treatment. We know that Black women carry the burden of uterine fibroids at a much higher rate than their white counterparts, and Black women are more likely to experience symptoms. It has far-reaching social implications. For example, in the US, it is the leading cause of Black women missing work. Again, more research needs to be done. And Black women need to be aware of the options and given the opportunity to engage in meaningful discussion about their healthcare. And the more we as a community engage with the healthcare system, this leads to increased trust with the healthcare system, especially into fibroid research. So that is the end of my presentation. Thanks very much. And I'll give the floor over to Ngozi.
Well, to both of us really, Patrice, because your talk has generated lots of questions. I think it's, we have a really knowledgeable audience. I think that's why people have joined us this morning. There are people here who have fibroids and there are some really good questions in the chat. I've had some questions come to me privately, but thank you so much. And I think it was really impactful hearing from women who have actually had, have been suffering from the condition. You know, someone who's had to give up work. The fact that you say it's a leading cause of work absence in US. I wonder whether it's the same in the UK, but it's just that that research hasn't been done, because I think almost all my friends have had fibroids at some, most of my Black friends have had fibroids at some stage in their life. So I'm going to go through the questions now, some of the questions, because they're really important. So there's someone here that said that throughout her reproductive life, that she had quite large fibroids, but they don't seem to be affecting her now that she's gone through the menopause. What's the effect of the menopause on fibroids?
Okay, so with the menopause comes a reduction in your estrogen production. So the ovaries don't produce estrogen. We know that fibroids are sensitive to sex steroids, sex hormones such as estrogen. And so with menopause, the fibroids shrink. Certainly you shouldn't be getting any new fibroids. So if you're getting, if you are constantly having scans to just monitor the size of the fibroids, you shouldn't be seeing anything new. But the fibroids would shrink in size. So I don't know how large these fibroids are, or if they are impacting on, say, your bladder or the rectum and giving you other symptoms. But if they're not causing any symptoms, they can just be monitored.
Okay, that's good to know. Because I think one of the main effects of having large fibroids is very heavy periods. I suppose after the menopause, where you don't have any periods anymore, at least that's one of the symptoms that will disappear. Yeah. So there's another question here, really important question. After treating fibroids by operation, do they grow back again? And Antonia has actually helpfully said, well, she had an operation and they grew back again. So I think she's answered the question, but I think perhaps we could just explore that a little bit more, because there'll be people here thinking, I'm going to have an operation. I don't want to have that operation if it means that, it's going to grow back again. Does it grow back in a year? Is it something that if I'm 40, if I have the operation, I know that maybe in 10 years time I'll be going through the menopause? I think that's important, because lots of people have an operation, and if you're worried it will just grow back again, you might not have it. So yeah. What can you just
so I know the statistics are that within 5 years of having a myomectomy, because obviously with the myomectomy you remove the fibroids but the womb stays intact. So there is like a 60% chance of those fibroids reoccurring. Hopefully not to the same size or the same numbers as the ones before, but they can reoccur. And it also depends on what stage or what age you had those fibroids done. So if it's done still within your reproductive cycle, so from up to age of 50, there is chance for those fibroids to regrow. But if it's done close to 50, then they may not, because you then go through a natural menopause. So it all depends on what stage of your reproductive cycle they do grow back. But fibroids, yes, they can grow back. Okay,
that's important to note. I think there's lots of questions about the procedure, the Sonata that you showed, because that looks like that's new, is it?
It's very new. It was, and the reason I knew about it was because in our group of doctors at work, they were quite happy when it was done. It was just probably done a month ago. It has been around for a number of years in Europe and in the US, but I know that within the Northwest, it has just come on board. So the statistics look good in terms of patient getting symptom relief. I think 99% of patients within a year are still symptom-free. And it's so much better than the medical management we have at the moment, because we do know stopping the injections, or if you stop taking tranexamic acid, or whatever medical management you have, those symptoms remain, and fibroids can regrow after stopping some of the medical management. So the Sonata so far has proven to be quite useful in treatment of fibroids.
A really important question, is it available on the NHS?
Yes.
Great.
Yes, it is available. I don't know about the waiting list. I'm sure there's a waiting list. Because of the pandemic, as you know, Ngozi, our waiting list have been stretched to the limit, and women that were on the waiting list to get a hysterectomy couldn't, and that led to even more admissions to hospital because of complications. So the waiting lists for procedures are quite long, but again, it's at St. Mary's, which is a tertiary centre, and you'll need to be referred to that centre by, well, first of all, by your GP, and then the specialist there at St. Mary's.
Okay. Okay, there's lots of questions, and I'm going to group them all together about the if there's any explanation about why they come back. And there's lots of people who have put in the chat about having a number of fibroids. So there's different ones. So somebody said that they had 8 fibroids and then removed and left with 6. The operation didn't work as well as they thought it would be. The mammectomy didn't work very well. There's another one about the different symptoms that the fibroids have given. There's chronic back pain, there's pain in the ovary, and constantly feeling tired. I think maybe because of the amount of, with this many fibroids, I guess it will be causing menorrhagia, which is very heavy periods. Now, is there a different way of managing when you have lots and lots of fibroids? Would you always advocate that they did surgery? Are there better treatments when you have multiple small fibroids?
Well, we deal with fibroids by the symptoms that they cause. So if you have even one large fibroid that's causing pressure on your bladder, pressure on the rectum, or causing excessive blood loss, well, then that one fibroid needs to be treated. And for now, the most effective way of treating really large fibroids is myomectomy or a hysterectomy. With the fibroids that are multiple in number, again, if we can't get control by medical management in terms of tranexamic acid or the hormonal injections that help to shrink the size of the fibroids, then the option would be surgery again. Prior to doing surgery that involves very large fibroids or multiple fibroids, we will usually give patients a course of these injections to help shrink the size of the fibroids to make it easier to remove and the surgery less complicated. So as I mentioned, unfortunately, fibroids do come back because they're stimulated by estrogen, and we can't ablate the estrogen production for too long, because that can have a negative impact on our bone. We increase bone loss if we if we have really low estrogen levels. So it's important to get that balance between the hormones that are used to treat or shrink the size of the fibroids and symptom relief. So that's again more research needed into getting safer options, medical options of dealing with these fibroids. As I said, the Sonata is there. Whether it can treat multiple fibroids, as we saw in that picture I showed where the patient had multiple fibroids. I don't know how effective that is in treating multiple fibroids, but it's definitely an option that's new, and it would be interesting to see how that would help women with multiple fibroids in the future.
Okay, thank you, Patrice. And you will know about this, I'm sure people have asked you this before. There is a concern, a worry that for many Black women who have fibroids, that one of the first options one of the options that they are given is a hysterectomy. And sometimes they're told that because of the size of the fibroids that this is the only option they have. And then maybe they're encouraged by a friend or somebody else to go and seek a second opinion and find that this is not the case. So I think the option of a hysterectomy as a sort of first line treatment or even a second line treatment is a concern. So what messages we have, because there might be people listening to this who have been told to have a hysterectomy. Is there any advice we can provide for them to what to do next?
That's a really good question, Ngozi. I do think women who are told that they need hysterectomy, they may have tried various different modalities. I think for most women, that is really the last option. Surgery is the last option. However, I'm not sure if they would have been given the choice of having the uterine artery embolization, for example. That's another option for another alternative for treating fibroids. Again, there are not many centers that do that. I do know that Withenshaw has that option there. So they do need to be given various options. And that's, I guess, that's what this whole talk is about. Just educating women, letting them know that there are other options available for them. And hysterectomy is not the only one. But after, say, trying various options and it does not help resolve their symptoms, well, then a hysterectomy is a definite management to do. That will definitely get rid of the problem. But of course, we have to take into account the woman's what does she want to have a family for the children. We have to take into account various other problems and her beliefs as well. So this is important for women to bring up with their gynecologist. What other options are available for me? They need to ask that question directly.
Okay, there's lots of questions as well. I'm trying to group the questions, everybody. I mean, some of these questions are so depressing about, you know, the length of time, the fibroids, they've had fibroids, the effects on trying to become pregnant. It's really depressing looking at some of these questions. And it just means that this is such a problem in our community. So I think thank you so much for doing this talk. So I'm going to ask now, there's lots of questions about diet. And I think it's a theme that runs through many of our talks, that people would like to know about the effects of diet on fibroids. I think some of the questions are, so I'll group them in as they've come up. So some of them are direct effects of any diets. Secondly, there's people who have had fibroids, they're now in their menopausal period, have thought they would shrink, but still have quite a large abdomen. And they've been doing lots of exercise. Yeah, I know they've been trying to do lots of exercise to try and get rid of this large abdomen, but it seems that no matter what they do, it's still quite large when they were hoping that they would shrink now that they're menopausal. So just two questions in terms of lifestyle, exercise and the effects of fibroids and food.
Okay. So exercise, unfortunately, does not affect the size of the fibroid. I mentioned healthy diet and exercise earlier on as advice for just general health and maintaining like a normal weight, so that obesity, because we know that obesity, because of the extra fat stores, that produces estrogen as well. So it's not only your ovaries that produce estrogen, but also the fat stores. So in obese patients, you have extra estrogen in your body as well because of this extra estrogen being produced in the fat stores. So by maintaining a healthy weight, you don't have this excess estrogen in your body to stimulate the fibroids. So indirectly, it leads to, say, fibroids that are not as big, okay? But after the age of menopause, we are expecting fibroids to shrink. They may not shrink completely. It depends on the size you started off with. For those women who have really large fibroids and it's still persistent to the menopause, I would say to still have it monitored through your doctor or through the hospital by just yearly scans, because seeing this fibroids shrink in size can have like a positive mental effect on a patient. And there is a very small risk, and I don't want to scare anyone, but say like a less than 1% risk that if they persist, it can become malignant, but that is really quite rare. But it all depends on what size you start off with, and it's important to have that discussion with your gynecologist and your GP about how to manage those size fibroids after the menopause. As far as the diet is concerned, I don't know of any diet that can directly affect the size of fibroids. Diet, again, is just having a good diet is just important for your general health and well-being, but no diet per se that can directly affect the size of the fibroid.
Okay. There's a question about the link between fibroids and fertility. So does it cause miscarriages? Can it stop you from getting pregnant? And if you are pregnant and have fibroids, your options for delivery, does it mean you always have to have a cesarean section? So these are the questions related to fibroids and fertility.
Okay, so with fibroids and fertility, the position of the fibroids has a lot to do with the problems of fertility. Also the size, I would say, has a lot to do with it. Because if you have a fibroid that is large enough to occlude the endometrium, the cavity in the womb, then there's a difficulty with that embryo implanting into the womb, into the lining of the womb, and actually growing in size. There's a risk of premature labor because that baby just doesn't have the room to grow, and mom may be at risk of going into premature labor and deliver early because of that. There is also a risk of miscarriage, okay, if that embryo cannot implant into the endometrium or has difficulty implanting there and not, again, able to grow because of the fibroids impinging on its space. If the embryo is located near the fallopian tubes, again, you have problems of that embryo moving out of the fallopian tubes and implanting into the lining of the womb. So it can cause problems with fertility. I know of some patients, they were having problems, they had their myomectomy, and the following year they were pregnant, and fibroids was the cause of their infertility. So it doesn't always cause problems with fertility. I know many women who got pregnant having fibroids and went to full-term pregnancy. So each case is different, each woman is different. Again, it all depends on the size and the position. Now, with the women that do manage to become pregnant and go to a full-term pregnancy, yes, there are risks in delivering this baby. If she's had a previous myomectomy, that is, they removed the fibroids from the womb, it's suggested that she has a cesarean section, because the risk of going into labor with a scarred womb, meaning there's been a scar because you've had a cut on your womb, there's going to be a scar there. That is an area of weakness. So if you go into natural labor with really strong contractions, there is a risk of that scar actually rupturing and opening up. And that is catastrophic for baby and for mom if that happens. So in all patients with having a myomectomy, especially those that have penetrated the lining of the womb, we recommend having a cesarean section, elective cesarean section. Some women do need a cesarean section in labor who've got fibroids for other reasons. Maybe their baby gets distressed, they've never had any previous surgery, so they go for natural labor and they do need a cesarean section. But sometimes that fibroid is located on the same area that we make our incision to deliver the baby. So those women are at risk of heavy bleeding during the cesarean section. If the bleeding can't be controlled, they're at risk of having hysterectomy in order to control the bleeding. So again, the position has a lot to do with your risk. That is why women with fibroids greater than 4 centimeters have regular growth scans in pregnancy. First of all, to locate the position of the fibroid. Secondly, to monitor the size of the baby, to make sure the baby is growing well. So you don't always have to have a cesarean section if you have fibroids, but in certain cases it's recommended. So the care for you is quite tailored if you're pregnant and having a baby.
I think the key word there is tailored. Now, as I said, I have lots of friends, and all of us here, and we're such a large, over 200 of us who've logged on to this today, and other people watching on YouTube and on Facebook. So there are many of us, and many cases will be individual. So someone's put in the chat that, you know, you said that weight affects fibroids. So they put in the chat, well, I know lots of slim people who have fibroids. I know lots of fat people who have fibroids. You will hear people who say, I've had fibroids for years and I get pregnant very easily. It is so individual that this is a sort of general message for everybody about the effects the majority of fibroids have. But for you, it could be very individual. So if you're still left with concerns, pain, you need to see your doctor and ask them to refer you to a gynecologist who can give you specific treatment and advice for you. So this is a general talk which leads you in the right direction, but many of the things, because fibroids come, they can have, you have one big large one, you can have multiple small ones. Someone's asked about pedunculated fibroids. That's another specific one. Would you like, we've had about 3 or 4 questions about pedunculated fibroids. Would you like to say a little bit about that? Because they're slightly different, isn't it?
Yeah, slightly different. They basically, they look like a fibroid on a stalk that can hang outside on the surface of the womb. But they can grow in size as well. I think they're a bit easier to remove if you do have surgery, because you just tie off that stalk. You don't actually have to incise the womb. But they're usually there in addition to other fibroids as well. So they're not really special. But one of the things I haven't mentioned is that fibroids can cause pain, not just with the heavy bleeding, but if it runs out of its blood supply. You can get that in a pedunculated fibroid. If it runs out of its blood supply and the blood, it outgrows its blood supply, then what happens is that the tissue that's in the center of the fibroid doesn't have access to that blood supply, and they die off. And that dying sort of necrotic tissue can cause pain. So even without the woman being on a period, if she starts getting pain and she's got uterine fibroids, that would need investigating and management as well. So that's another thing that that can cause pain in uterine fibroids. It depends again in that particular one, the pedunculated fibroid, or even the fibroids that are in the womb can become necrotic if it outgrows its blood supply.
There's a question here about the effects of breastfeeding on fibroids. That do they help to shrink or reduce the number of fibroids? Is there any effect at all about breastfeeding on fibroids?
No, I haven't heard of any research on that or any discussion about that. We do know that breastfeeding can help monitor your weight and can help reduce your postpartum weight, but directly, no, it doesn't have an effect on fibroids.
Okay. There are a number of questions about blood supply. I know you've touched on blood supply and also clots. So some people have been told that just by having fibroids, that it means that they have a more propensity to develop clots. And there's another question, I think, based on embolization. So somebody's put in a message that they've had women in their family who have had pulmonary emboli and have been told that this has been caused by having large fibroids. So this person has actually gone and tried to do her own research and hasn't found any information to support this. And they just wondered about whether you have heard of anything that will link fibroids directly to just developing blood clots.
No, there hasn't been a link between fibroids and blood clots. It doesn't affect your clotting factors. It doesn't affect your ability to clot. It's just that your bleeding is excessive at the time of your period. But as far as affecting the blood to clot and giving you pulmonary emboli, there's no evidence for that.
Okay. There is a question about calcification of fibroids.
Mm-hmm.
And what that means. So this lady's been told that her fibroids have calcified and is not really sure of what that actually means.
I haven't seen calcified fibroids in quite a while, but basically it means that that those fibroids are like no longer active. They're no longer causing heavy bleeding, and that the body is basically trying to reabsorb the fibroid per se, but again, that shouldn't cause any long-term problems. Again, if you've got a calcified fibroid, it may not be that all the fibroids are calcified. You can still have some other fibroids that are there, that are active, that are it's still growing in size. Usually the calcified fibroid has stopped kind of growing. So it doesn't really have any long-term consequences.
Okay. Now, the other thing that has come up before, and I've seen this, is the link between hair relaxers. Yeah, you know, you must have seen it yourself, Patrice. Hair relaxers, different creams that Black women use for their hair, that this is linked to fibroid, development of fibroids.
Right. I haven't seen any. Again, we lack research, don't we? We lack research into the environmental factors. We lack research into the dietary factors, genetic factors that cause fibroids in Black women. I haven't seen any research about that. Yes, you do hear these links, but whether there's any evidence for it, I haven't heard of it. But we don't have much research going on. As I mentioned, only 15% of the women involved in fibroid research are Black women, when it disproportionately affects more Black women. Again, that is something that we need to address, but I haven't heard evidence of that because of that. I know it can cause other things, hair relaxers. It is an artificial chemical, you know, getting into your bloodstream. So it can cause other things, but not related to fibroids. Thank you.
I think because, I mean, I don't know, I see links for lots of things with fibroids, but I think it could be a tenuous link. This is because if it's more common in Black women, and Black women use hair straightening creams and relaxing creams and other creams for their hair, there could be a tenuous link that people put two and two together. Mm-hmm. But unless you've done the proper research, and we have loads of examples of things like this in medical arena, where people have made a link, but when you've examined it properly and thoroughly with research, that link isn't there. Mm-hmm. So there hasn't been really good randomized controlled trials, which are the pinnacle of our research, ability to do research, that have made that link.
I have seen a tenuous link with chemical hair relaxers and breast cancer. I have seen that. Again, they're done on very small studies, but there is a link between those sort of chemicals and breast cancer, but not with fibroids. Remember, fibroids are benign. So that's another thing I wanted to say. And they're not cancerous, they're benign. They are contained within the uterus. They don't spread out of the womb like cancer can. So it's not cancerous, but it can still impact a great deal on your life. So we do need to treat it and be on top of it. But I know the link between hair relaxers and health would be more in the cancer direction.
Thank you. There's questions. I know we talked about diet, but remember, because you talked about estrogen, the impact of estrogen on fibroids, I think there remains a worry that maybe because some of our maybe milk and things that we have hormones and chemicals, that they're worried about these hormones and chemicals coming through the food that we eat and then impacting the fibroids?
Mm-hmm. I mean, that would kind of make sense. Again, it's not an area that I have really researched a lot into. And that, again, is another, I think, an area of research that needs to be opened up, that link between diet and uterine fibroids and, you know, high estrogen levels. Exactly what are we consuming in our food, and how that impacts on these smaller areas, or how it impacts on these areas of our lives. Again, it's not something I have myself have done a lot of research into. I know a lot of women out there probably would have, because of the impact on their lives. But one thing I do know is that there's been a link with low vitamin D levels and being a risk factor for fibroids. So we know low vitamin D has been linked to many other things, like low mood. It's been linked to decrease in immunity, and osteoporosis. So it's important that, at least that's one thing I can say, get your vitamin D levels checked, or even start taking supplements for vitamin D, because we could never, I think because of the climate that we live in, not getting enough direct sunlight, it can affect our vitamin D levels. That's the only small link to diet that I know of.
Okay. One of the themes that has come through this, I think this is why these talks are really important, is research. And there are lots of offers of people to say, look, we need to increase our participation in research.
Yes.
Yesterday, Faye and I were at a meeting of the Race Health Observatory, and somebody came on and said, we are now setting up some research, and we found we haven't been able to find Black women to engage. I mean, Faye put her hand up straight away and said, I can find you lots of Black women who will, because they keep calling us hard to reach communities. Look at this morning, there are more than 200 women here who are really interested in finding out about fibroids, contributing to research. There are more people who are watching on other platforms. They should stop calling us hard to reach, because we aren't hard to reach, they just need to ask us. And, you know, research projects have traditionally been in areas where people are prepared to fund, and they haven't been prepared to fund research projects that are predominantly going to affect the Black community.
Yes.
So I think the fact that we've set up Caribbean African Health Network that can attract some of this funding, or at least direct people at that. If they want Black women involved in research, or any the Black community, we can, we're happy to engage. I agree that hard to reach is just an excuse. I mean, I was shocked that a meeting of the Race Health Observatory, they were saying that they cannot find Black women to participate in somebody's research. It was a pregnancy research. Okay, yeah. I'll just try and see if there, this is another question I think that I can't leave without saying, is the big C. People are always worried about cancer. I know you've said that, I think you mentioned it briefly and said, I don't want to scare anybody.
Yeah.
But people have asked, is a fibroid a tumor? And I think people, if you look at the textbook, they might say online, they might say a benign tumor, but it's good to clarify that, because once somebody says tumor, you worry.
Yeah.
Can fibroids become malignant? So can fibroids actually develop into cancer? So those are a number of questions. I'll just group under that, you know, the big C.
Okay, so basically tumor means excess growth, okay? So the cells of the smooth muscle wall of the uterus grows excessively. While they're growing, they're laying down fibrous tissue. And that combination causes these kind of balls of what we call uterine fibroids. So basically tumor means just excessive growth. So cancer occurs when it starts invading into another organ, or spreading whether it's directly or through the bloodstream or through the lymphatic system. So fibroids do not do that. They don't. We do have stories of women after the menopause. Sometimes the cancer can coexist with fibroids. I wouldn't say that fibroids can or there's cancer forming from the fibroids, but I do believe eventually can coexist with a new onset of malignancy. But as I said, that's very rare. Fibroids are benign. They're known as benign tumors, and very rarely they can kind of coexist with uterine cancer. And I believe the illusion is that people think that you can get cancer from fibroids, but that has not been, that is not for the majority, the vast majority of cases.
There's a question about, and I don't think any talk is complete without this at the moment, COVID-19.
Mm-hmm.
So any link between COVID vaccine and fibroids growing back? Any link with the COVID disease and fibroids itself?
No, none at all. So the COVID vaccine, everything is all, this is all new for us, okay? So there's no link that has been found between the COVID, the actual vaccine, or the COVID disease itself, and uterine fibroids, or even fertility. So that link has not been found.
Okay, now I'll just go through some short questions now. One is, can you confirm that Mirena helps to keep the growth of fibroids down or slow them down?
Mirena does not shrink the fibroid. It just helps to alleviate some of the heavy menstrual blood loss by acting on the lining of the womb. So it can shrink, reduces the thickness, the lining of the womb, and that in itself helps to reduce the blood loss, but it does not shrink the size of the fibroid.
There's another question about age and fibroids. So is there any, I've heard this before about the earlier you have a child, the less likely you are to have fibroids. Is any relationship between age of childbirth and fibroids?
There is a link with not having any children and fibroids. So you find women that haven't had any children at all at risk of fibroids, large fibroids, multiple fibroids. So you find that link between, number of children and fibroids. So if you have no kids at all, there's a link with getting fibroids.
I remember someone saying to me once, anecdotally, that nature tries to fill your womb. So if there's no children there, then you get fibroids. I remember being told that by one of the nurses when I was a medical student, and that sort of helped me to remember the link. Yeah. But so much has changed, so I wasn't sure whether that was still true, whether there was. And you think that you have a higher risk if you've never been pregnant. That's right.
There's an element of truth with that. That link has been found by research.
Okay. Is there a link between fibroids, the rate of growth, and the sort of contraceptive you use?
So if you use the combined pill, the dose of the estrogen in the combined pill is really low. So that shouldn't really cause your fibroids to grow. It's quite low. So there isn't a link with that, and I can't think of any other contraception that would cause your fibroids to grow. Okay, if anything, going on the combined pill actually helps to reduce the amount of bleeding that you get. So in some cases, the doctor may actually discuss with you about starting you on the combined pill to help with the symptoms of fibroids, which is the heavy menstrual bleeding.
Okay. And this is more of a comment though, but I think it's a really important comment that someone's put, that there are so many things online offering lots of herbal remedies, elixirs, that they will say shrink fibroids, and sometimes will have testimonials to back their claims. And some of these remedies cost lots of money. What advice can you give about these herbal remedies and elixirs that are advertised online?
Yeah, so I think, there's a big market for this sort of treatment, because there's just so many women with uterine fibroids. As we mentioned, 80% of Black women will have fibroids by the time they're 50. So it's a huge market for that. I can't recommend any of them really to shrink the size of the fibroid. I don't know people that take it if it's merely coincidental that their fibroids are not so much of a problem, or their symptoms have resolved. And again, there hasn't been any research, and that's what we need. That's the cornerstone of giving any medical advice. It's the research to back up your claims that this particular herb or this particular combination of herbal remedies can help. I'm not putting down, herbal remedies. I'm not putting down that at all. I believe in holistic medicine, but I need to have the research to back up holistic medicine.
Thank you. So I'm just going to read through two last comments. And this is from Charmaine. So thank you so much for sharing this. Charmaine says she's of average height and weight. She's really fit. She does lots of exercise. She's had multiple fibroids. She's had various treatments and many of them didn't work. And she decided to opt for a hysterectomy and is at home recovering, and makes a note that everybody's different. And she hopes this experience helps somebody who's listening in today. Yeah. And lastly, this comment just made me smile. I visualize my fibroids as Sigourney Weaver, the second. That's her main fibroid, that's what she calls it. And her friends will take an alien ship and disappear into another galaxy away from her uterus. And she puts a big amen to that. So Val, thank you for making me smile. And lastly, Patrice, thank you so much for this. You can see it's just generated lots and lots of questions. And I hope we've been able to answer most of your questions and provide some answers. There's been some questions about seeing people privately if they cannot get their response from the NHS. And I think the CAHN has a list of doctors who are prepared to see women privately and will be able to give out that information. So I'm now going to hand back over to Charles just to round up. But thank you so much, Patrice.
Okay, you're welcome. It's a pleasure.
Thanks, Ngozi and Dr. Patrice once again. I think Faye will do the honors and close us. Over to you, Faye.
Thanks, Charles. Wow, wow, wow. Thank you so much, Patrice, for that really insightful presentation to fibroids. We know it's a really important topic, hence, we've got a good attendance today. So thank you so much. It's a topic that's of real passion to me as well, and I'm really pleased that we are covering so many of these women's issues on these health hours. So grateful as always to Ngozi for hosting so well, for fielding the questions. Lots of questions today, and I'm sure we're all really empowered with some of the responses that we've been given. Just want to say these health hours are so incredibly important. We've been running them since May last year, and every single Saturday we have Ngozi hosting them. We have our GPs, our consultants attending, presenting, giving their time for free to empower our community. So really want to encourage everybody to attend them every Saturday between 11 and 12:15. And I always say, have it on in the background. If you're busy doing your shopping or, cleaning, whatever you're doing, join in, log on and just have it on in the background. There's always something every single week to learn. So please join us. We've got a whole month of November of health hours to bring to you. Next week, we're looking at psychosomatic disorders with our GP, Dr. Omifumu. He's looking at, he's got a special interest in mental health. So he'll be looking at those disorders, looking at the link between psychological disorders or conditions and physical health as well. The whole of November has been posted in the chat, so please have a look and see what we've got coming up. But just to alert you to Saturday, the 4th of December, we're going to have a panel discussion about faith, health and medicine. So please join us for that. Every Saturday we have the same link. So if you've lost, if you don't get an invitation, every single week we've got the same link for you to join in. So just to finish, we have on a Tuesday, we have our Healthy Heart session. There's some really fantastic work going on where there's the nutritionists are challenging us with tailored support program in the form of a group challenge, looking at ourselves, what we eat and how we're accountable to each other. So there's a forum that's been set up where people can join the link, post what they're eating, look at how many steps, what they're doing to actually lose weight or manage their diet. And there's going to be a little video shown just shortly, just to kind of like say a little bit more about what's going on a Tuesday between 5:30 and 7. Please join in. There's always a link between these conditions, physical activity and nutrition. So please join in with us for that. So once again, thank you, Dr. Patrice. Thank you, Ngozi. Thank you to everybody for attending, those on YouTube as well, on Facebook for joining. Please join us again every Saturday. And I'm going to hand over to Elizabeth now to play the little video on the Healthy Hearts. So enjoy the rest of your weekend. Thank you.
Do you have a nutrition related goal? Now, this could be that you want to lose weight or maintain a healthier weight. You want to get onto the DASH diet because you're struggling with high blood pressure, or you want to be able to better manage blood glucose level because of diabetes. Whatever your nutrition goal is, please do come on board. For more details, join us on our Healthy Heart sessions on Tuesdays, where we'll be telling you about exactly what the program will entail. Don't miss out on this great opportunity. This is the only way we can change the narrative for our community. This is the only way we can prevent these conditions and improve our health as a community. I look forward to seeing you this October as we start this new journey towards wellness for our community. CAHN Health Hour. Get informed today to have a better, healthy tomorrow.